Hi, everyone. My name is Julia Madison, and I'll be the technical manager for this session today entitled Where Are Caregivers' Needs in the Agriculture to Nutrition Pathway, Measuring the Resources They Need to Provide Optimal Care and Feeding, chaired by our wonderful colleagues at USAID Advancing Nutrition. So thank you all so much for taking part in ANH 2023. We're looking forward to a really robust and interactive session today. So thank you all again for joining this online learning lab, and I'm going to hand it over to Neha to take the conversation forward. Thanks, everyone.
Thank you so much, Julia. So hello, everyone. Good morning, good afternoon, and good evening. And thanks so much again for joining us for our learning lab on measuring resources caregivers need to provide optimal care and feeding. And so I'm happy to introduce the facilitators we have for this session. I'll begin with Dr. Stephanie Martin, who is an assistant professor at the University of North Carolina at Chapel Hill Department of Nutrition. And her research largely focuses on the design, implementation, and evaluation of social and behavioral interventions to improve nutrition during pregnancy, lactation, and childhood. Dr. Martin is currently examining interventions to increase fathers, grandmothers, and other family members' support for infant care and feeding and adolescent nutrition in multiple countries. She has published widely on family engagement and nutrition and leads a community of practice on family engagement. Next, we have Kenneth Mulando, who is a senior technical advisor and the interim secretary general of the African Society for Social and Behavior Change. He also runs a private social marketing firm in Uganda. Mr. Mulando has more than 2 decades of experience in social behavior change and SBCC in Uganda and the region in private and public sector initiatives. Most recently, he led SBC for the USAID-funded ICANN project, which integrated nutrition and agriculture with resilience. Ask him for contact information in the chat to join this group if you're interested. We also want to recognize the contributions of Dr. Kate Dicken, who was unable to join us today. Dr. Dicken is an associate professor in the Department of Public and Ecosystem Health at Cornell University. She conducts formative and implementation research on maternal and child nutrition, as well as food security and the effectiveness of social and behavior change interventions designed to strengthen community-based nutrition programs. Dr. Dicken has published widely on child feeding, nutrition, and child development, and has researched how family dynamics influence child feeding. And my name is Neha Javeri, and I am a social behavior change specialist with USAID Advancing Nutrition. So here's an outline of what we have planned for this session. So first, we'll start with a poll to hear from you all on your experiences with caregiver resources. And then we'll move to hearing on an overview of caregiver resources, and we'll also share a theory of change based on food security and nutrition program in Uganda. We'll also work through 2 exercises to practice identifying these resources and navigating the caregiver resources toolkit. And then we'll finally close with a discussion for sharing experiences. And we'll also have a little bit of time for a Q&A. After this session, we had a few learning objectives here listed. So after this session, we'll hope you'll be able to describe the intangible resources caregivers need to provide care, practice where these resources fit into real-life nutrition-sensitive program theory of change, and also explore a bank of measures of caregiver resources that you will hear more about in upcoming session. And now I can turn it over to Dr. Stephanie Martin to provide a more detailed overview of caregiver resources.
Thanks, Neha, and hello, everyone. Thanks so much for being with us today. We're excited to hear about your experiences related to caregiver resources and how they influence the work that you're doing. When we think about the resources caregivers need to provide nurturing care and support optimal nutrition, we often think about food, money, assets, other material items. And then I could see from the poll that in addition to those, we think about health resources and also the intangible resources like psychosocial factors or time sufficiency that caregivers need to be able to provide nurturing care for their children. Resources for caregivers were first described by Patrice Engel, Purnima Menon, and Lawrence Haddad in the 1990s. And they, at that time, expanded the UNICEF conceptual framework for nutrition, really highlighting the role of these resources that caregivers need. And I think we'll stick, the link to that document is in the chat. So the caregivers resources that we're going to be focusing on today is really building on this work from more than 20 years ago. But we've also looked at subsequent conceptual work and research that's been done over the past 25 plus years to come up with a list of these intangible resources that caregivers need. In this figure, we are highlighting the caregiver resources that we're talking about today and placing them within a socio-ecological framework. So when we talk about the intangible resources that caregivers need, we're talking about mental health, healthy stress levels, perceived physical health, safety and security, equitable gender attitudes, self-efficacy, social support, time sufficiency, autonomy, education, knowledge and beliefs, as well as nutritional status. And we recognize that although these are often at the level of the individual caregiver, all of these resources are influenced by multiple factors across all of the levels of the socio-ecological framework. And so that's why we've sort of placed them within the context of this framework. So since this seminal work by Engelman and Haddad in the 90s, subsequent nutrition frameworks have also highlighted the importance of caregiver resources for optimal nutrition. And so I just wanted to share a few of the nutrition frameworks that some of you may be familiar with from the past 10 years or so that highlight caregiver resources, just to call attention to their importance as we're thinking about the pathway from an enabling environment to improved maternal and child nutrition. So here from the 2013 Lancet series, within the pink box, it's highlighting caregiver resources. In the USAID multi-sectoral nutrition strategy, it also, though not using the exact same words, it also highlights these intangible caregiver resources. And then the most recent UNICEF nutrition conceptual framework also highlights sort of resources in general, but it provides a space for the intangible caregiver resources we'll be talking about today. And I think just now I'll turn it over to Kenneth, and so he can share how caregiver resources have been thought about and conceptualized in his work in Uganda.
Thank you, Stephen. Slides coming up. So mine's a simple one. We're going to have a small exercise where we're going to walk through how the activity I worked on, which was basically a resilience activity, how did they build their theory of change? Lisa, if you could reduce the slides a bit so that we start from down. So to begin with, we had a lot of activities that went into building the theory of change for ICANN. ICANN was, as I mentioned, was the flagship resilience activity for USAID in Uganda. And within that, we had activities or interventions that came and these were basically tracked for progress and to also build commitment. But what were those activities? We had a general thinking around what would be included in a social change in terms of themes, and we had things like collective responsibility. We had committee members sharing things around self-reliance, model leadership, and joint decision-making, which would basically build social cohesion both at community level and the household. And within that, we had so many groups that we worked with, and those were the MyCAN groups, which are basically for the maternal groups. And then we also had the farmer groups, because this was basically also livelihoods. And then we also had the leaders as a special group that we looked at too. So there was a bit of social support through those groups. Partnerships were key for linkages. Then for ownership, for things around WASH, something around community-led solutions was something which were very keen and also very important. And within that, we also had gender as a key focus for the activity, and that's a cross-cutting thing that we tried to see implemented across different, the three sub-purpose areas of the activity. So all these were tracked for progress in terms of interventions. And also we tried to drive a commitment for participation and action. And doing that, we saw a lot of connection between, linkage between, or relationship between commitment and actual behavior. And that's something that kept on growing. When we move from that, we move to the next level where the communities describe their resilience capacities. And these were basically things to do with households, raising and growing diverse foods, business providers, supporting farmers to aggregate their produce for better prices and negotiation on the market, farmers saving for a purpose. And this could go for education for the girls, education for the boys, grow improved crops and cultivate household gardens. These were more what we call kitchen gardens. And these were basically what we saw as resilience capacities being strengthened. Households using their savings for food and services for children. The VHTs, the health village teams delivering quality services through the groups. And also we had households practicing joint decision making and also improving gender attitudes about men's roles. And this kept on changing as the activity, it wasn't cast in stone, this changed. When income increased in the household, what did it mean for the woman? What did it mean for the man? And how they respond in terms of attitudes around their roles. And that was the whole programming in terms of readjusting the theory of change as we see it now. What that took us to was now what we had as our responses or behavior outcomes. So we saw a bit of increase in diverse foods, and that's something we aimed for year round. We hoped we would have use of quality nutrition and health services, and also have improved feeding and care practices coming out. And that will lead us to our high level outcome, which was basically improved diversity of diets of children 6 to 23 months. And the overall goal will basically be that improved food and nutrition security, both in the household, community, and at the district level. So ICANN worked in 8 districts, and this was something that was being driven. So overall, the theory of change was if vulnerable Ugandans increase their income opportunities, diversify their livelihoods, adopt improved practices to improve nutritional status, and participate in inclusive and effective governance processes, then they'll achieve sustained gains and the ability to respond and recover from shocks and stresses. So this was subjected to the realities on ground. COVID-19 was a shock that came through during the activity, and some of these things were tested, and indeed we saw some bit of bouncing back and people be able to demonstrate resilience amidst COVID-19 in terms of how agriculture remained the core, and food production was not affected, and both nutrition was not really affected by COVID-19 in these 8 districts that we worked in. So in a nutshell, that was the ICANN theory of change and the pathway that we're talking about, and the practical of trying to unpack it through the activity. And thank you very much.
Thank you so much, Kenneth. That was so helpful. It's very nice to hear you talk that through. And I wonder, just to frame what's coming in the next few minutes in our session, would you mind elaborating a bit more on where some of the resources fit specifically within this theory of change, where you would situate them, if you don't mind?
The resources in terms of human, or which kind of resources, just to get you right?
Yeah, perhaps, social support, or any of the ones that we're discussing shortly, self-efficacy, etc. Yeah, that would be great.
Support and efficacy would basically come down just below. Unfortunately, they'll come just below what we have around community leaders tracking progress and encouraging commitment. So some of those resources like social support, self-efficacy would basically be at that level, and we'll basically press them at that level to say how are we standing in terms of social support, and also looking at things around around self-efficacy. Those will basically be at that level. But again, we'll take it up a bit to see things around the resilience capacities, to see that again at that point, for example, the attitude of men, of gender, improved gender attitudes about men's role, something around self-efficacy would come out at that point, and we'll bring out some of those terms of resources and have them placed across the resilience capacities as well. So it's both at the interventional level, but also coming out at the resilience capacity level. So those are the two levels which are down and below, and I'll basically try to place them at that level.
Thanks so much, Kenneth. That was really well said, and I think really helpful in framing what we have to come. So USA Advancing Nutrition has created a measuring caregiver resources toolkit, and that's helpful when measuring caregiver resources, which you've heard until now is a critical step toward understanding where there are gaps and how interventions can support caregivers and impact caregiving resources to improve nutrition outcomes. So this toolkit that I'll share the link for in the chat shortly presents a set of measures of caregiver resources that are relevant to the care of young children, and in particular nutrition outcomes. There are measures for 8 caregiver resources related to nutrition that are included. And you can use this toolkit to identify caregiver resources of interest to build a comprehensive program theory of change or a monitoring and evaluation plan. If you do open up, let me share the link in the chat here. So for each caregiver resource, there's an overview page and a list with the links to the relevant measures. And at the link for each measure, there is a description of how it is applied and scored and where it has been used in relation to child nutrition with a link to access the measure. And you can find measures by clicking on the caregiver resource in the navigation bar that you'll see on the right-hand side, or by using the search function. And you can also filter by geographic focus. And using the caregiver resources toolkit, referencing that, let's see which measures for a selected resource in this caregiver resource toolkit that you would think would fit in the following exercises we have up here. So we will launch a poll before we close out today's session today. But before we do that, we had a few key points that we'd like to reiterate as you leave today. So first of all, caregiver resources underlie both the participation in care and thus the effectiveness of nutrition interventions on children's outcomes. And families, communities, and services shape caregiver resources. That's something that we'd really like to reiterate here. And if you recall Kenneth's sharing at the beginning of the session, as well as the exercises, it's important to consider and measure what it takes to provide care within all pathways from agriculture to nutrition for greater impact. And lastly, as now you are much more familiar with, please use this online toolkit that we've created to identify, adapt, and apply measures of caregiver resources to better design and assess programs that catalyze change. And we thank you so much for participating today. On behalf of everyone, well, Stephanie, Kenneth, myself, and Lisa, thank you so much for joining us today. This has been a wonderful session, and we can't thank you enough for your participation and sharing out and these really thoughtful responses that we've received. And thank you once again.